Hi, this is Dr. Scott Boden with the Hair Restoration Center of Connecticut, and I just want to introduce you to a patient of mine named Jim. Jim is a man in his mid-30s who, like a lot of men in their mid-30s, began to lose hair. He's got a lot of hair as a baseline, but was losing the front. As his front hairline was receding, he became more self-conscious. Here's some pictures of Jim and a close-up of his hairline. He did an FUE procedure, the follicular unit excision procedure, and he's had very successful results. He's only had one procedure and he's using medical therapy to support what he has. So I'm here with my patient Jim. We're 2 years after an FUE procedure, and Jim's got a lot of hair, and actually started out with a lot of hair, but what we really did, lower the hairline and strengthen the hairline. So if you look closely, there's natural irregularities. This is what a FUE hair transplant should look like. This is what every hair transplant should look like. Has anybody made any comments over the last couple of years about your hair?
No, just that my hairdresser always complains that I have a lot of hair.
Does anybody know you've done a hair transplant, or did anybody guess you did a hair transplant?
No, they just said my hair looks good.
Cool. So thanks for paying attention. I hope we get to meet. My name is Dr. Scott Boden with the Hair Restoration Center of Connecticut.